Welcome to another episode of What's Up Refresh. I'm Dr. K.
And Nurse Fatima.
And we welcome you to have a great discussion about different things in the aesthetics and wellness world. Hopefully we can educate you and even possibly provide some entertainment for you. And hopefully you get something great out of it.
Don't forget to subscribe to our YouTube channel, follow us on social media, and leave us any questions or comments you have that we can answer. And also feel free to call and text as you wish when you have any kind of question. We love to educate.
All right, so today what are we going to talk about, Nurse Fatima?
We are going to talk about sun damage.
Sun damage.
Especially this past summer and the years before, and for those of us that have not done a thing.
Okay, so sun damage. Wow, that's a big topic. But all right, so I think sun damage, what a lot of people refer to as sun damage, is typically people will get like brown spots, or they may get, if you have freckles, they can sometimes get an exacerbation of freckles coming out.
Especially most clients that we see complain of sun damage that they have accrued on the driver's side and on their hands, on their chest.
Yeah, especially in the décolleté area. So a lot of times actually, a lot of the sun damage, if you didn't know, actually happens before you're the age of 18. And then it starts to come out later on in life, anywhere from 30s on up. Typically, mostly around 50s to 60s, you'll really start to see it. But the good news is there's things that you can do to help it. There's a lot of different modalities that we use to treat sun damage and keep it under control so that you can look fresh and clean.
What happens when one comes to Refresh Med Spa LA? We get a consultation. Dr. K will get you cleared medically first. We take some pictures. And what is the first question we ask before we do any type of treatments?
Well, in regards to energy-based treatments, we always want to know what your sun exposure has been. Like, have you been in the sun, within the last few weeks or not? And then, of course, your heritage matters with this because, different types of skin respond differently, and not all treatments are for all different types of skin. So we always try to get into, what is some of your background heritage and how your skin reacts to things so that we can kind of help formulate a good way to treat those brown spots. So
we also ask the question, what is your sun exposure in the weeks to come? So basically, to make the story short, the point of this is that we like to deliver a safe and effective treatment, because if you have been in the sun and you get a treatment, especially energy-based treatment, even a non-energy-based treatment, it just makes the treatment outcome possibly not so good. But if we kind of take the pre-sun exposure and post-sun exposure a little more, put a little more importance into it from our side and your side, from the client side, it makes the treatment much, much better and safer and effective.
But to help kind of clarify things about why we're talking about all this, let's first talk about what treatments there are available, and then that'll make a little bit more sense about why Nurse Fatima was talking about the sun exposure issue. So one of the things that causes all of these pigments to come up is your melanocytes. Those are the cells that live under the skin that, when you get exposed to sun, they get active, they make melanin, which is what pigment is, and hence you get sunspots. So a lot of the things that we do actually are designed to help calm down those melanocytes so they stop making pigment. And then the rest of the treatments will focus on the pigment that has come to the surface of the skin. We want to remove them so that you've revealed a fresh, healthy skin underneath that does not have pigment built up in it. So that's really where we're focused at. So as far as treatments, we have several different options.
So it starts with the brightening pad, which is something that you would do at home. And it's the easiest and most affordable one of all. And one of my favorite actually is the brightening pads. The second thing is just our regular fantastic Skin Wave Aqua Facial that removes a lot of that dead skin off and it lightens up your skin.
This is a really good one. It's something you can do year round, but it's especially helpful when you're trying to deal with pigment because it does exactly what I was just talking about. It very gently with the water based system. It helps to get rid of that exfoliate that external layer that's got the buildup of pigments in there, and then it also has several solutions that help to calm down the skin as well and help get it cleaned up, which is why the Skin Wave Aqua Facial is a very good
and speeds
treatment.
up that cell
Mm-hmm.
turnover. The next favorite one is the VI Peel, which is another amazing facial that removes all that dead skin off. And within over 7 days, and then actually over the next 4 weeks, your cell turnover speeds up and that dead old layer comes off and you actually get a good result and a safe result from that.
So this is a little bit different than like your typical peels that like make your whole face fall off, and that these actually don't make your whole face fall off. It's a very uh, easily tolerated type of a treatment, and so you actually can be presentable and still hang out and go to the grocery store and all that, which is really important for us, especially here in sunny Southern California. But additionally, the VIPL also has some additional components in there which again are working on that deeper layer to calm down those melanocytes. So I keep harping on those two things because those are the two most important things in terms of treating the sunspots. All right, what other fun goodies do we have?
Then the next one is the IPL photofacial, the 3 for Me laser, erbium laser, the Titan Bright, the Cool Peel, and our fantastic RF microneedling.
So those are all really good ways. The IPL is particularly good. That's kind of been the tried, true, and classic version of getting rid of brown spots. So we call them sunspots, brown spots, liver spots, age spots. They've got all kinds of names to them, but they essentially all fall into the similar category, and they're treated very similarly in terms of taking care of them. But IPL is definitely one of those tried and true and tested ways of getting rid of that as well. And it's a light based procedure. Again, the reason we do that, have you not be exposed to sun beforehand and afterwards, is because we're also still using an energy based system to get those melanocytes to stop making pigment. And if they're already pre-excited from having been in the sun, it could potentially cause an issue with the pigmentation. So we need to be safe and make sure no sun exposure beforehand.
Well, that will sum up our talk for today. We will dive into each one of these treatments a little more in depth. And actually, there are videos on our YouTube channel on each one of those treatments. But number one, please and please wash your face at nighttime. Apply your vitamin C morning and night. Use your retinol at nighttime. Apply your vitamin C before your sunscreen in the morning, and sunscreen must be on every day. Sunny day or not sunny day, cloudy days are worse. Just to let you know, sunscreen is a everyday kind of business.
Even if you're hanging out at home, that sun creeps right through those windows. So it's still important to have it on. All right. Well, I hope this was some good information for you, and we hope to see you guys soon on another episode. And we'll have some more chats and education on aesthetics and wellness. Thank you for tuning in to What's Up Refresh. I'm Dr. K.
And Nurse Fatima.
We'll see you soon.